Hey again, and welcome back to our channel. We hope you've been having a great week. Today we are going to cover 14 hidden signs your body is trying to tell you something. Things like snoring and hair loss may be totally harmless, but if any of these 14 symptoms persist, don't ignore the warning signs. Signs from your body. Maybe you're losing more hair or gaining some extra weight. Perhaps you're always tired, or your partner says you snore. There are probably harmless reasons for these everyday happenings. But maybe there's something more serious going on. From gassiness to sleepiness, muscle cramps to weirdly colored nails. Here's a look at some hidden signs you might not be as healthy as you think. 1. You're bloated. Just because you follow doctor's orders, you eat your greens, choose organic when you can, exercise regularly, and get 8 hours of sleep each night doesn't mean that your health is in the clear. You may think your post-dinner bloat is totally normal, but sometimes a subtle symptom like that can signal a more serious health issue. Simple reasons for bloating include constipation, overeating, or reflux. More serious causes include infection, inflammation, irritable bowel syndrome, Crohn's disease, and some medications. 2. You snore. Snoring happens when air can't move freely through your mouth and nose. As you sleep, the muscles in your throat relax, and your tongue can slip back in your throat and can be caused by adenoids, nasal polyps, or even just a stuffy nose. If you're overweight or have had a lot to drink, you're more likely to snore. 3. How to know if your snoring is cause for concern. If your partner notices that you stop breathing for long periods of time, you should consult a specialist. Treatments for simple snoring include losing weight, treatment for allergies, sleeping on your side instead of your back, and avoiding alcohol before bedtime. 4. You're gassy. Believe it or not, passing gas 13 to 21 times a day is normal. A lot more or a lot less than that could indicate a problem. Not passing gas indicates that your bowels aren't functioning properly, but passing gas too much or too often can indicate a food intolerance or a digestive disorder like gastroesophageal reflux disease, Crohn's disease, irritable bowel syndrome, IBS, or celiac disease. 5. You're always tired. If you always feel lethargic, no matter how many hours of shut-eye you get, it's definitely worth talking to your MD. Unlike drowsiness, which is the need to sleep, fatigue is lack of energy and motivation. It can be a normal response to lack of sleep, lots of physical activity, stress, or even boredom. But fatigue can also be a sign of a number of health problems. 6. You have bad breath. Bad breath or halitosis is the most common reason for dental referrals after tooth decay and gum disease, according to a review of studies published in 2018 in the Open Dentistry Journal. Sure, the culprit could be all that garlic you consumed at your last meal. But sometimes bad breath is a sign of something more serious, usually caused by bacteria on your teeth and tongue. Bad breath can be linked to poor brushing and flossing habits, or oral issues like dry mouth, gingivitis, or periodontitis. In some cases, sinusitis, bronchitis, tonsillitis, and some gastrointestinal issues can also trigger bad breath. If brushing and flossing doesn't help, see your doctor or dentist. 7. You get headaches regularly. Besides being a pain, literally, headache's the most common form of pain. According to the National Institute of Neurological Disorders, and stroke are often pretty harmless, but some headaches are more serious than others. Talk to a doctor if a headache is sudden and severe, or is accompanied by a stiff neck, or follows a blow to the head or pain in your ear or eye. Get medical attention if you have a headache and fever, convulsions, confusion, or pass out, or have a fainting episode. If you've never had a headache before and suddenly have your first, it's time to ask your doctor what's up. 8. Your muscles cramp up. Everyone suffers from a muscle cramp now and then, especially after a tough workout. In fact, a review of studies published in 2018 in Journal of Electromyography and Kinesiology suggests that exercise-associated muscle cramps are the condition most often requiring medical treatment during sports. But some conditions can increase the risk of having leg cramps, like being dehydrated, having low levels of electrolytes, taking certain medications, having a nerve disorder, or an underactive thyroid gland, hypothyroidism. 9. Your nails are a funky color. Nails are supposed to be pink, so if yours are venturing into any other color category, speak to your doctor. Funky colored nails could be harmless, according to the American Academy of Dermatology. But it could also be a sign of various skin disorders, if not something more systemic, according to research, including a study published in 2015 in Indian Dermatology Online Journal. 10. You're losing weight. Of course, this doesn't apply if you've started a new diet or exercise program. But if you're not trying to lose weight, and you're losing more than 5 pounds without any effort, then you need to see a doctor. 11. You're gaining weight. Just like unexplained weight loss, unexplained weight gain is also something to see a doctor about. Many people will dismiss it, says Dr. Bhatia. They think they can get a handle on it, and before they know it, 10 pounds has turned into 20, has turned into 30. 12. You have a low libido. If you never feel like getting frisky between the sheets, you might want to talk to a healthcare provider about it. You wouldn't be the first. It's a common complaint I get from women, but it's increasingly common in men. 13. You're losing a lot of hair. Shedding between 50 and 100 strands of hair per day is normal, according to the American Academy of Dermatology. But if you're losing more than that, you should call your doctor. 14. You're not regular. If you're eating a high-fiber diet and drinking a lot of water, and you're not pooping regularly, take note. The digestive system needs to empty to reset for other things, and when it doesn't, there's a shift in bacteria that then drives inflammation, which leads to chronic disease. How was our past videos? Please let us know in comments section. If you like this video, please like and subscribe to our channel. Thank you for tuning in.